Welcome to Sugar's Beauty and Wellness. I am your host. I'm Dr. Ayala, and I have Bibi from Bibify Aesthetics, right? And she's in Leonona. Welcome.
Thank you.
So excited to have her. I've been behind you, trying to have you on my podcast for a little bit because we want to talk about a technology that I think is amazing, and I wanted to get her brain so we can talk more about it. I think two brains will work better than one brain. So, and I hate my jaws, so let's do something for it.
Dive into it.
Let's dive into radio frequency microneedling, which is Morpheus8. So, baby, why Morpheus? Like, why did you want to have Morpheus for your practice?
Well, when I got introduced to Morpheus, I saw I was amazed when I saw the before and after result of what it can actually do for someone. So especially now with the whole thing with weight loss and the skin laxity, and we're starting to see all the sagginess in the skin, and then seeing those before and after photos of what it can do, because everybody's very familiar with microneedling. So now we're pairing microneedling with radio frequency. So we have all the great benefits for our skin, and then now we're tightening the skin.
People think it's something new, and I always tell them, microneedling has been forever in the market, and radio frequency, it has been forever in the market. They just putting them together. It's just really not something new. But just like you, I fell in love with the results of the Morpheus, and it was 2022, back in time, when I say I want this for my practice. I know that I love holistic medicine, I love combination therapy, and I was like, this is something that I want to have because I want to see the results on me. And my first patient was my mom, and she was like, this is good for just one treatment, because we only did one treatment on her. So what have been your experience with it, the results and everything?
And the same, as I got introduced to it, my first client was my mom as well. So she's older in her years, and so she has a lot of that loose skin. We did some weight loss with her, and then we were really kind of just focusing the neck area, a little bit of what we were talking about, the jowling, so really getting into the jowls. But with her, we saw great results, and we did finish out 3 treatments. Her skin was it helped with pigment issues, it helped with her pores. I mean, we got some.
That's what I've seen a lot with Morpheus is the pores. Like on every patient, when they come back from their before and after pictures, I'm like, this looks smaller. Like this have trimmed. Like this is. I'm actually seeing this on patients. It's not just what the manufacturer tells you. Like it is good for this, it is good for that, but when you see it.
When you see it, yes.
And your actual patients.
So there's more, not just hearing it, but actually seeing it, and then just kind of seeing it for yourself. Have you had a Morpheus treatment for yourself? So, we've had it, kind of knowing what to, your expectation to give your client.
But I don't think a lot of people understand why does it help, or what's the technology, the science of the technology that it do something for your skin. And we're in the medical field, so we know what it does, but for someone that doesn't, or when I get a new client for a consultation, I like to make the analogy of building a house, right? So when you're building a house, you're putting the blocks and you're putting the foundation. That's your Morpheus.
Yeah.
So Morpheus is stimulating that collagen production. And I like to pair it. I 100% believe in combination therapy. I think you do too.
Yes, absolutely.
And I like to kind of bring, you can do IPL, which is great for pigment. And in my case, I like to bring in my CO₂. And combining those 2 treatments, I make sure the house is being built correctly. And after I'm building my house, it's finishing touches.
Yes.
Fillers. So I like to kind of make that analogy for patients so they know how it works. So tell me about your patients. What do they say when they do Morpheus?
I think, the scary part is someone who doesn't know much about Morpheus. There's a little stigmatism out there of, is Morpheus painful or, stuff like that. But if the person is operating the device, as they should in the settings and not, so, I mean, making them comfortable is number one.
It's important.
Yeah, that's definitely important. So getting them through the treatment. I've seen great results from, I've done on weight loss, not only just weight loss, but doing the the bra line, the flanks. I've done flanks, like the back of the bra fat.
Yeah.
I've done like the little love handles.
I haven't done that myself. I'm gonna have to give that a try.
I've had some good results. Like my client, like her waist, like I was like, oh, hello.
I wanna have the hello too.
So I got good results with that. We've done some abdominal tightening, not only just for face, but also for the body.
Because you can use it in the body as well. I am not an expert at all doing Morpheus in the body, but it's good to know there's some other areas that you can use it too. I love it on the face. I love it on the neck. I think the skin tightening that I do get with the Morpheus is amazing. I mean, it's not a surgery, obviously, and I think realistic expectations are extremely important when you first meet this patient, because some are like, oh, I did not see any result. You just had it done, give it time.
And definitely I say like trying to complete the 3 treatments is the recommendation, because that's where you're going to really see those beautiful results. After your first treatment, you're going to see a difference. Your skin is going to look more plumped and you're going to see it. And then once you treatment 2, treatment 3, and then like
if you stick to it, you will see the results. And like you mentioned, is the pain situation that scare people out. And if you go to someone that has a medical license that can prescribe medication, then they can use numbing cream that is prescription strength.
Yes.
I know you use a really good one coming from Manatee Pharmacy. And they're good because that's the exact same one I use.
Absolutely.
And it really, really works for Morpheus. But
you do have to let them sit. So like if you do want to rush the procedure as well. So giving it the time so that actually penetrates and kind of numbs them up. So that's going to help.
I numb an hour. I think you do also do an hour, because anything less than that, I wouldn't want to put my patient through that, honestly, because I do want you to experience the procedure, because the results are there. You just have to give it time to see those results and use combination therapy. Just one treatment is not going to be enough. Combine it with IPL, CoolPeel for that skin resurfacing, your radius, your Sculptra, your Botoxes.
Or even getting them on good skincare regimen.
Yes.
That is going to be number 1 too. Number 1 is getting them on a good skincare regimen, and then the results will speak for it.
Yeah, because what will be the point of investing time, energy, and money in all these procedures, and then you go home and use a CeraVe cleanser? I'm gonna be so honest, because honesty is so important in this business. And I have had clients coming for consults and they don't use SPF, and then I say, I'm sorry, I can't do this, because you are a walking billboard to me. And if someone looks at you and they say, oh, your face looks horrible, they're going to ask you, where did you go? Oh, I'm not going to go there. So I have to make sure you get results and beautiful results so you can send me patients over. So I would say if you don't want to agree to have a good skincare routine, I can take you as a client, because then you're not going to see results, you're going to be upset, and it's just not good business in my opinion.
So having that good foundation, so starting with good skincare regimen. So that's where they start. So kind of building that in, and then making sure that they follow the after treatment. So SPF is definitely another part of it, especially if you're living in Florida. Yes. And even on a cloudy day, you need to still.
Even if you don't leave the house, even on weekends, I might just stay home with my son and my husband, and I'll still put my SPF. Mm-hmm. Even though I'm in walls, I'm not going outside, but it's part of my daily routine, so I don't forget. I don't leave without sunscreen. And the funny thing is that all I have on my face right now is my lasting SPF. Yes. I don't have foundation, even though it looks like foundation, and I keep saying this over and over, and I have literally put the foundation on camera, the SPF, so people can tell, oh, it's really an SPF. Because it's a beautiful thing.
Once you tinted, yes.
Yeah. Once you take care of your skin and you're on a good skincare regimen, sometimes you don't have to even use a foundation and put all those chemicals into your skin, as I call it. But what's your favorite skincare to pair with Morpheus8?
So in my clinic, I use Zio.
Okay.
So I have like a package, like getting skin ready. So a lot of them, or even like the anti-aging, which the anti-aging, it has growth factor in it. So that's it's amazing. So they actually do see the plumpness in their skin as well. So either getting ready or the one that has the anti-aging with growth factor.
What does the getting ready entitles for those that don't know what CO getting ready is?
So with ZO, they have, well, you can buy either individual depending on how you're pairing it, or even just if you're unsure with some of the starting packages, it comes with like a cleanser. You have a toning pads that also helps with the skin. You have a polish which helps to exfoliate. That is amazing. And then a moisturizer to help with hydration. So that's in the getting started.
And I think their CO moisturizer is actually called the Daily Power Defense, which is full of antioxidant. It's like a power anti-aging moisturizer.
Yes.
That's how I tell it to my patients, because it is. That's what it is. And you have to invest in your skin. And I know it sounds scary when you go for a consult and you have in mind, I'm going to do this procedure, and then they're like, you need the skincare, you need the pose, because you need to make sure the results are there. And if you just do the treatment and forget about the rest, then you're not going to see amazing results. And I don't think you should do that too.
No. And I had talking with several clients, and I always ask, what's your skincare entail? And they say, St. Ives. Is there's no
That's
medical
scary.
science behind it or something like that. No, we could not use that. At least if you're going to start over, a non-medical, CeraVe or La Rouge.
I like La Rouge. I would say if you financially can't do medical grade skincare, that's okay. I'm not gonna turn you away because you can't do medical grade skincare. But at least your active ingredient should be medical. Yes. Like your cleanser is fine, your SPS is fine, your moisturizer is fine, but your antioxidants, your vitamin C, your retinoid, at least as a minimum, that should be medical grade because they're backed by science and they're working.
Absolutely. Yeah.
So I would rather you spend your money in vitamin C and retinoid, and then go out and get your cleanser from La Roche-Posay or your moisturizer from La Roche-Posay if you're on a budget. Because I don't want you to think
oh no, yeah,
like you're obligated to do anything like that.
But with Morpheus, and that combination, you just get beautiful results. And, like I said, it's not only the face, but using it on the body.
I'm going to have to visit you to do it in the body.
And I mean, it has other benefits too. Even someone who, I did a recent consultation in hyperhidrosis.
I saw that and I was like, can I do that? I was like, I need to try that myself. Hey, no shame here. I use Dysport for hyperhidrosis myself. I'm okay with that. I can say that it's perfectly fine.
Neurotoxin is great. And then also that's the great thing of having the Morpheus is that now you have this extra tool and device to.
I'm going to have to visit you so you can do these treatments on me because I need that. And I can't do it myself. I can't do that. I'll kind of jump. I had a patient that wanted to do Morpheus, but she heard horrible things about Morpheus destroying the fat in the face. What do you think about that?
So with that, it's actually knowing the settings, right? So somebody who has beautiful plump cheeks, do we really want to go at a really deeper depth? And then that's where we're going to lose that fat. So knowing the settings where we want to keep the skin, the plumpness that they do have, we want to retain that and we don't want to lose that. So it's just kind of really the person who, knowing your device, knowing the settings, and that way you don't lose that. Okay, we don't want to lose that plumpness that we still have in our cheeks. We just want to address, so we will go at a lower depth than going really deep and getting into fat.
That's what I say to my patients when they're like, I don't want to do it because I heard horrible things. And, I want to explain to you and I want you to know that I believe you and I know what you're telling me. But let's talk about science and let's talk about what's actually happening in your skin and why you might be losing that fat. It's the wrong settings. In my opinion, if you go deeper than 3 millimeters, 4 millimeters, you're
going to lose that fat.
And those are the horrible stories that we do get from Morpheus because I believe that's true. And it's not the device, it's who is
handling
the device of the Morpheus. So don't give up on Morpheus because I think it's very powerful. I think it really works pretty well. We just need to know how to use this device.
And just having the education too, and any type of any pigment, because Morpheus is great because it's all skin types. So you have all your skin types are just knowing the settings, and then just, making sure we're not dragging. So I think that sometimes when we have like sometimes dealing with some pigment issues, or if they're leaving any type of marking, it's because they're not actually, it's like a dragging motion as it's.
And ours, we're Latinas, so our patients that are Latinos, I don't do Morpheus immediately. Like, I want to pre-treat their skin, honestly, because I don't want to cause PIH or pigmentation that can happen with radiofrequency and even lasers. I will put in a pigment inhibitor easily for 2 weeks. I'm gonna get your skin ready to, be able to tolerate the procedure. And when doing things correctly, you're gonna have high satisfaction, and you'll return as a patient, and you recommend your friends and family to come see us because it works. It's really good. You get amazing results, but you need to know how to use it, when to use it, the depth to use it. The pre and post is so important.
That is so important, is following the pre and post.
Yeah,
I agree.
Do you have any sales coming out for Morpheus? Like any new sales for Morpheus? Any packages, options for your followers?
Well, so currently, we have some, things coming up as Vivify is turning 2 soon.
Yay!
But for now, definitely, I have packages for like my, especially combining those with not like my weight loss clients. So, I think, having that skin, the loose skin, and just help combining that, I have packages that I've been seeing.
I think packages are great, honestly, because you're combining technologies. And I honestly say, and this is something I have learned by working with the machine, with the device, learning, going to conferences, going to training, because you probably invest a lot of money in training. I invest a lot of money in training because I want to keep gaining the knowledge.
Things change and you learn new things, new tricks that kind of help. And
that's how I learned that you need to do this in combination.
Yes.
You have to do your Morpheus with either your CoolPeel or your CO₂ laser or your IPL or even your biostimulators. There is a really amazing physician that I saw her talk in AMWC in 2023, I think it was. Her name is Dr. Grupo, and she's from Spain. And she was talking about Morpheus, and I was like, oh, that caught my attention. And she was saying how in one setting, she will do Morpheus, she will do a laser, and she will do Sculptra on the exact same setting to give amazing results to your patients. And she was showing her before and after, mind-blowing.
Yes.
The thing with United States of America is that there's a lot of restrictions, that stuff that we can't do that we know is good. Like, I know you know who Dr. Shinobe is. Everybody knows who Dr.
He's
Shinobe
amazing.
Hi, if you're seeing this, the odds are low, but who knows? And he talks a lot about combination therapy. And he, in one of his studies, he was mixing radius with NCTF. And NCTF is not FDA approved to use in the States, obviously, but in other countries it is. Oh my God. If you haven't read that paper from Dr. Shinobe, you have to, because the results are crazy, mixing skin nutrients, which is NCTF, with the radius. So at least now we have something called PDGF.
Yes.
Now everybody knows about PDGF, and I think it's a good option to combine with Morpheus, because yes, Morpheus is good to strengthen the skin and give that skin tightening, but for under eye darkenings, I think we still need something else. And I do think that's where PDGF, in my opinion, comes in place. Have you used PDGF?
I have not. So yeah, so usually like for now, like I use just my client's own plasma.
Okay.
So PRP.
Yeah.
And just microneedle that.
Fine.
Exosomes too, kind of. I do it more like post. So just really helps with the, not microneedling into the skin, but with the post, the healing, and then just giving just beautiful results.
I love exosomes to use post any treatment,
Yes,
honestly.
yes. It's kind of like almost like it's a package.
Yeah.
You're with me, you're getting your Morpheus treatment, and then you're getting the exosomes, and that really helps with the healing process and just the glowing.
I think it's amazing to use these nutrients to use pose because my patients, once they're done with the Morpheus or even an aggressive CO₂, which I do, when you pair with PDGF or when you pair with exosome, the inflammation is crazy how it goes down. Like I did a split test actually, and I did one side of exosomes and one side without exosomes. And the side with exosome, like I wasn't even red in a few hours. And then the other side, it was still red.
Yes. And then the time difference between is like just like a rapid, like just, yeah, that redness after the treatment is very minimal. And it's, you know, with Morpheus too, there's very minimal downtime.
It is.
That's the great thing about it.
That's what I love about it.
Minimal downtime, mild redness.
You can go to work the next day.
Absolutely.
As long as it's not a construction or
not outdoors. You don't want to be outdoors in the sun.
Not landscape. But you can literally get your Morpheus even on a Saturday, rest Sunday, and go to work on Monday. Because it's that minimal downtime is what I love. It's what I truly love about Morpheus. And when done properly, is beautiful. It definitely is. The way it builds collagen and that skin tightening. I'll go with a good setting. I don't know in your experience what those settings are, but I see that if you stay at 1 millimeter, 2 millimeters, multiple passes, that in my opinion, that's what gets the skin tightening and the straining of the skin. Now for the submental fat, I go deeper, obviously, because that's when you do want to burn the fat on the face. And I do 3 millimeters, I do 4 millimeters depth. I go hard. I go hard to get rid of the old chain. Yes. And I like it because you're burning the fat, but you're also doing the skin tightening. Yes. Isn't that amazing?
Yes. We have all these great benefits all in one.
All in one device. And people shouldn't be afraid of Morpheus because I know they are. And I hope they're watching this podcast because I truly want them to be educated about Morpheus. There's so many horrible stories out there that it hurts. Yes, it can be uncomfortable, but with the proper numbing cream, it should be fine. One patient, I even prescribed her Xanax, like 0.5, just to kind of have her relax during the procedure. And then she brought her husband, and her husband drove her home, obviously, because I wasn't gonna let her drive herself. But even if we need to use prescription, it's possible. It's definitely possible, especially if you're very anxious.
Mild things that I've used too is I have a little fan. It's kind of just blowing and cooling the skin down.
And the vibrator.
And then they're just like, oh, okay. It's not what I thought at all.
Exactly. I always hear that. I actually had a patient in 2023 that I don't know if she likes pain or not. I still don't know. But we did 3 treatments of Morpheus, face, neck, and then she came back for her knees, which was very strange. But she said, oh, don't use that numbing cream. It got me very numb. That was my face. I was like, like, what do you mean got you very numb? She's like, I feel very numb. No, I want to feel the Morpheus. Okay.
Maybe just making sure that it's doing what it's supposed to do, which it's going to do.
It is, right? It works. The numbing cream does really work. I just found that very interesting and odd that she told me that she did not want to use that numbing cream because she wanted to feel the
Kudos
Morpheus.
for yeah.
So that was cool. When I do Morpheus on myself, I actually don't use the manatee one because I want to save that for my patients. I use a regular prescription BTL.
And BTL works. I mean, I've used both. Yeah. So honestly, I have used both, and it's interesting enough because I guess just depending on the area that I'm working on, I guess it's about the same, but I've gone and interchanged between both and got through the procedure with minimal discomfort.
I think it's so worth it. That extra expense that we do endure is to make patients as comfortable as possible. I love Morpheus. I think if you're watching this and you haven't tried, I think you should give it a try. Anywhere that you are, if you're not in Florida, anywhere that you are, just give it a chance because it's really worth it. And we start losing collagen at age 30, like 1% every single year because we're aging. Exactly. So if we can start early just to kind of slow down aging as much as possible, then I would. Like, sign me up.
And it's, not invasive. So
it's not.
and depending, you have to really kind of screen your clients. So who is a good candidate? So like, who's a good candidate? So, mostly I think everyone, it just depends on how much skin laxity or loose skin that they have. That's going to play.
Being honest too, if I think you need a facelift,
You need surgical, yes.
I'll tell you, hey, you need a facelift. Now, if you don't want to have a facelift, that's okay. We can work on get you good, but you're not gonna have a facelift results. As long as you're okay with it, as long as you understand you're not gonna have a surgical result with a non-surgical device, I'll do it. Yeah. Why not? I do it. I do want to help you. We might need 4 treatments. We might need 5 treatments instead of a regular 3. Combining with Sculptra, combining with Radius, even with filler. Like if you're very depleted on your cheeks, I can do Morpheus for skin quality, but I need to replace that volume that you have lost. And that will come with fillers, which I think they still have their own place in this industry.
Absolutely.
I love fillers.
Yes. When it's put in the right place and not overdone, yes.
I will do your cheeks. Yes. And I will do your jawline. I can even do a Morpheus, and then right after I can do fillers. That's what Dr. Grupo was doing in Spain. She will do your Morpheus, your laser, and then she will finish with your fillers. And I think that's amazing. You only go through the process once, honestly. One thing I wouldn't combine together is talks. I don't know how you feel about it.
Yeah, I would probably have them come back at a later time. So I definitely will wait. So I do the IPL, which I probably start with like IPL and then move on to then do the Morpheus afterwards. And then
I haven't had an IPL. I might have to go see you.
So it really too like targets some of my clients who are dealing with a little bit of rosacea. So that redness. So we're going to target the rosacea. We're going to target the all the skin laxity.
I'm going to document my visit to Babyfy Aesthetics because I'm going to get an IPL. I need an IPL. I don't have an IPL. I have a CO2 laser, but I don't have an IPL. And I do have rosacea, and it's hard to control, as you probably know. But with good skincare, I have it very, very controlled, unless I go to the gym, unless I have wine, unless it's very hot outside.
Understand your triggers. Yes.
It's so red. It's so funny because I like to be as open with my clients as possible. And if I'm having a rosacea flare up, I'll do a video. And I say, this is what rosacea looks like. One day you're fine, and then 5 minutes later, you're all red. Did you do IPL on you?
I did IPL, and then I did my Morpheus treatment. And I was amazed. I was like, okay.
Some people say, and correct me if I'm wrong, but some people say that if you have active acne, you shouldn't do a Morpheus8.
Correct. I would, like with any, if active acne, I would say microneedling, you want to, yes, be careful with that. Right. I definitely would be.
So I think we're cutting it to those 30 minutes. Is there anything you want to say before we conclude for today?
I mean, if you're considering, any type of microneedling and needing some skin tightening, Morpheus is definitely it's a game changer, and it's received a lot of recognition. Of course, a lot of the celebrities, they're celebrities, but I mean, for instance, like Lindsay Lohan, she looks great. Kim Kardashian, so they have great results.
Sofia Vergara, for the Spanish out there, she also does that as well. I do think we should give it a try. I mean, if you're in the Lake Nona area, go see Vivi. If you're in the Apopka area, come see me. If you're right in the middle, choose where to go. But we'll be more happy to treat you accordingly to what you need. And thank you for being with me for 30 minutes.
Thank you so much for having me today.
I'll have her again, and we'll keep talking about aesthetics and in the future. Well, thank you so much for listening. Until the next one.